As Benjamin Franklin observed, nothing in life is certain except death and taxes. Well, aging is also certain. Average life expectancy in the West is now above 80, and Australia is amongst the highest. We actually understand aging very poorly from a medical perspective because most of our efforts go towards curing specific things and specific problems. But aging is an insidious process that starts, some would say, in our 20s. It's not a problem that we can fix. If anything, modern medicine has only made the problem more obvious in that you now live longer and therefore you age more. It also highlights a few uncomfortable questions. Firstly, what is normal aging? Secondly, just because something is broken doesn't need to be fixed. Thirdly, is it ethically justifiable to do an operation to fix a limb which may endanger a life? Everything wears out eventually in this world and in this life. These aren't easy questions. I suspect as a society we've got used to easy answers, but old age is arguably designed to make us ask difficult questions. So this creates a problem. As a surgeon, I'm increasingly seeing patients who are older than 80, whose joints are wearing out. In surgery, we try to understand our risk and benefit analysis, or ratio, that is, what chance do I have of benefiting you with an operation as opposed to harming you or making you worse? The gap narrows as you get older. So to put it another way, surgery is really only a small part of the equation when you're over 80. Generally, your risks from any operation climb increasingly steeply once you get over the age of 70. So the operation itself is more risky. You have more chance of having a catastrophic complication. In addition, there is less gas in the tank to deal with any complication. When you're younger and something goes wrong, your body has some extra capacity, in fact a lot of extra capacity to deal with it, whether it be an infection or lung or heart or bowel complaint. So if something goes wrong when you're in this octogenarian age group, it tends to go badly wrong. Prolonged hospitalization, not returning to your previous level of function, are real possibilities, as is death. So you may ask what I would say if you are one of these 80-somethings, or you have an elderly relative who you care for who is in this position. The first thing I would say is if you're one of these patients, or if your mother, like my mum and dad, are having problems with arthritis after living a long and busy life, is that you need to make the decision as a family and with your family, not by yourself. Secondly, the family also needs to understand the considerable risks involved. There needs to be a plan for the possibility that things will not go according to plan. What if there is a complication? Again, complications are more common and more poorly tolerated. So one complication can lead to another, essentially a domino effect. There is a real possibility that things will not go as well as you're hoping, and you need to hope for the best and plan for the worst, as it were. Having said all this, though, that we are as safe as we can be with anesthetics, there are ways we can reduce the risks in the older joint replacement patients by using computer-generated designs in particular, and we are better at treatment than we ever have been. However, the one thing that seems to be a problem with knee replacements in particular is the swelling. The knee is relatively constrained by its anatomical location, and swelling in the elderly knee can take a long time to clear and sometimes does not clear. So that's worth thinking about. Are there any alternatives to surgery? Well, yes, again, weight loss is very effective at relieving the pressure on the knee. A simple steroid injection is often very effective. I'm not a big believer in other injections such as Synvisc or Durolane. They are expensive and don't seem to be more effective than a simple local anesthetic steroid injection. Anti-inflammatories can be very effective, as can a simple exercise program. If all else fails, then pain management techniques are also much more effective than they ever have been. That is, things like pain patches which emit a steady dose of analgesia to the body. So it is a difficult decision to have a knee replacement in your 80s. Please talk to your family, or if you're a member of the family, then get involved in the decision-making process. In particular, understand that the risk increases significantly as you get older, that any complications tend to be poorly tolerated, and that particularly with knee replacements, swelling can hang around for a long time. You may have pain, but the operation is not necessarily going to be as effective at taking the pain away as in a younger person. There is a possibility that surgery could make you worse. Consider other pathways, speak to other people. Don't make the decision until you have exhausted other options. Speak to your family. By all means, come and speak to me with your family. I much prefer to see you with a few members of your family so that everyone is in the picture and that you make a decision as a family unit, not as an individual.